Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The instruments and materials used for isolation with rubber dam on the Visidont are the rubber dam punch, the rubber dam material, the rubber dam frame, or anodon frame is this one is named, the floss ligatures, the water-soluble lubricant, the lower molar rubber dam clamp, the spoon excavator, the straight scissors, and the rubber dam clamp forceps. This demonstration will include the placement of rubber dam on the mandibular left quadrant, including the mandibular left second molar through anteriorly and including the mandibular right central incisor. It's customary to include the first tooth past the midline for each quadrant of isolation. Now the interproximal contacts must be pre-tested to be sure that it will be possible to carry the rubber dam material through them. This is done with the floss ligature, and each one is pre-tested at this time. It's also necessary to pre-test the clamp that is going to be used to retain the rubber dam on the most posterior tooth. In this case, we're selecting this lower molar clamp. In order that it be secure and safe to use, we always place a floss ligature on the clamp, developing it in this fashion, taking the floss material in a loop, and merely can place the fingers through it and carry this into a closed loop which can be placed over the clamp and onto the bow of the clamp and drawn down securely. This provides a handle in case the clamp should be lost during any part of the operation. Now, engaging the apertures of the clamp jaws with the clamp forceps so that the clamp can be expanded and carried to the second molar tooth. Then this will be placed over the tooth, first with the lingual and then tipping toward the buccal. Now the testing there reveals that the clamp is stable, is meeting the tooth properly in position, and will be a proper size and shape for this tooth to be used. After the pre-testing, the clamp is again removed for later placement. Then the rubber dam material is taken, and the upper right corner is cut with the scissors in order that its orientation may be retained during the entire operations of punching the holes and making the placement on the Visidont. Now looking at the rubber dam template for use with the anodon frame and the Visidont, we note that there are a series of dots on the template, and the rubber dam is placed over those dots and within the outline of this 6-inch by 6-inch piece of rubber dam. And using the series marked for numbers 18 through 25, we'll mark these each of these locations. (18, 19, 20, 21, 22, 23, 24, and 25. Now the rubber dam punch is taken. The punch has a table with openings in it and is positioned for the molar tooth first and placed over the rubber dam and brought to the position of the marking for the number 18 and depressed until the opening is punched. And then the other molar, number 19. Then the table is rotated to a smaller opening as is designated by the illustration on the template so that it can be used with the bicuspid. That's the second bicuspid, number 20, the first bicuspid, and the cuspid. A smaller opening now will be used for the lower incisors. The left lateral, left central, and right central incisor. Now the rubber dam has been punched and is ready for placement. Now bringing back the rubber dam clamp, first the clamp will be placed and then the rubber dam will be placed. The clamp again is placed so that the jaw will engage the molar tooth first on the lingual aspect. Notice that it's being dropped toward the lingual, tipped upward on the buccal, because it's possible to look carefully only at one or other of the surfaces. So it will be placed first to the lingual and then tipped over toward the buccal. When the clamp is in position, the forceps is slowly released until the clamp engages the tooth firmly with the 4-point contact provided by the curvature of the jaws. And then the forceps will be removed. Now looking closely again at the 4-point contact as the clamp engages the tooth, noting that there is no contact of the clamp with the tooth in the area of the center of the jaw, but that each of the points, 2 on the lingual and 2 on the buccal, engage the tooth so that the clamp has stability and will remain in place throughout the isolation of this case. Taking the rubber dam material and turning it to the reverse side, which will go against the tissue around the teeth, and using the water-soluble lubricant, a small amount is placed on the rubber dam and then spread very lightly to assist in carrying the rubber dam through the interproximal contact areas. Now returning again, and here's the time when this orientation of the cut corner of the dam becomes very important. Orienting it in the upper right and stretching the last molar opening of the dam in an oblong position so that it can be carried over the bow of the clamp. Coming over the clamp, sometimes this pressure is going to perhaps disarticulate the lower member of this Visidont. And then coming on forward to the lower right central incisor and carrying the dam through that area. Now, it may be necessary at this point then to take the ligature and place it on the tooth and carry the rubber dam material through the contact area. And at this stage, it's placed through with a double strand of the ligature and left in position so that the rubber dam can be maintained in that most anterior tooth. Now bringing the rubber dam up and taking the rubber dam frame. The frame will then be positioned, holding and placing the upper ends of the frame first, and drawing the rubber dam over the small pegs on the rubber dam frame. It's merely engaged. These do not penetrate the rubber dam, but merely engage the rubber dam with moderate tension. Now then, the middle pegs are used to pick up some more of the slack in the rubber dam, and just with a small amount of tension, they are held in position. Now it's possible to go back to the placement of the rubber dam and carry through these other contact areas. And by stretching the rubber dam, it will carry through the interproximal contact on many of the teeth. Some of them may require further assistance. It may be necessary or possible to spread the teeth slightly by inserting the thumbnail and getting the rubber dam to pass or start passing through. It's also possible and helpful to take another piece of ligature material, the floss ligature, and place it to carry the rubber dam through. It's always necessary to place the ligature material on the tooth and not on the rubber dam itself, but on the tooth and slide it toward the interproximal contact area and carry it so that it will carry the rubber dam through that contact area. And we'll carefully go around to each of these, carry the floss ligature through each of these contacts, making certain that the rubber dam has been carried through each one. Now it's possible to note here that the rubber dam, which was carried over the clamp, is not sealing around the molar tooth. The contact of the clamp against the tooth is fine, but the contact of the undersurface of the clamp against the gingival tissue is preventing the rubber dam material from engaging the tooth and producing a seal. When this occurs, we merely take the rubber dam clamp forceps again, insert them in the clamp, and very gently loosen the clamp just slightly so that the rubber dam material may slide underneath and around the tooth and complete that sealing operation. And finally, it's necessary then to do the eversion of the rubber dam. After the rubber dam has merely been placed, as is shown here, the rubber dam material is coming upwards on the surface of the tooth. It's now necessary, in order to produce a moisture seal, to use the spoon excavator and going carefully around the tooth to invert the rubber dam so that it is turned downward into the gingival sulcus. This is done with each tooth in order to provide assurance that moisture cannot pass through the rubber dam and seep in around the teeth. The same is accomplished on the lingual aspect of each tooth. Many times this eversion will take place when the floss ligature has been passed through the contact areas previously. Now finally, the rubber dam then is positioned, brought up over the upper teeth, noting that the frame is in a proper orientation to the arch. The curvature of the frame follows the curvature of the arch. The clamp is stable. The rubber dam is retained in the most anterior tooth, and the eversion around each tooth has been completed. The removal procedure is now rather simple, but must be done carefully. First, the rubber dam is going to be disengaged from the frame, and the frame will be removed first. The rubber dam clamp forceps engage the clamp and remove the clamp. The ligature was taken out of the most anterior tooth, the area that was being retained there. Now, using the scissors and stretching the dam away from the teeth and placing the finger underneath the rubber dam, between the rubber dam and the gingival tissue, the scissors are placed to cut the interseptal rubber dam one at a time. The rubber dam is drawn away from the tooth. The tips of the scissors should be visible each time before making the cut to assure that, that they are not injuring other tissue. And then the rubber dam may be removed, and immediately upon removal, the rubber dam will be inspected to be certain that all of the rubber dam material is there. Should there be any rubber dam missing, or any fragments of rubber dam missing, then it would be an indication that there may be a fragment lost in the interdental region, in the interproximal of the teeth, and this would cause injury to the tissues. And that's been inspected and is confirmed, then the removal procedure is completed. Now, a modification of the rubber dam placement necessary for the Class 5 restoration involves the punching of the aperture for the tooth to be isolated for the Class 5 restoration slightly out of line from the normal alignment from the template which was shown in the previous application. Noting here that, again, with the mandibular left quadrant to be isolated, and this being tooth 18, 19, 20, 21, tooth 21 with a Class 5 restoration to be treated, then will be punched slightly out of line to the buccal in order that the rubber dam is not stretching unusually far to be carried into that deep cervical aspect.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.